Hi, laryngeal cleft or laryngotracheal cleft. This is a congenital condition seen in newborns. So to have a better understanding of this condition, I'll start with the basic structure of the voice box or the larynx. The picture you see on the left side is the voice box, larynx, and this is the posterior view, and this structure is the cricoid cartilage. And this is a full view of the cricoid cartilage. So in this condition, what happens is there's a defect in the cricoid cartilage. So this larynx, what you have here, this is a larynx, and this is a cricoid cartilage, and below that it continues down to the trachea, which go down to both the lungs. If you see behind that, you have the esophagus also. So what happens is when you have a defect here in the cricoid, there's a high possibility that there is reflex from the, whatever reflex is there from the esophagus, it may easily trickle down to the larynx and make its way to the lungs. So this defect can be classified into 4 different types. And this is seen in premature children. This is the basic structure of cricoid cartilage. So if the defect is seen only in the involving the upper part of the cricoid cartilage, that is type 1. If it involves the whole of cricoid cartilage, it is type 2. If it involves the upper part of trachea, then it becomes type 3. And the last one, type 4, where the whole of trachea is involved. Coming to the symptoms. The child, whenever the child is fed, the child will have cough, choking sensation, cyanotic spells with or without breathing difficulty. And this is mainly during feeding. We'll first go ahead with a flexible laryngoscopy where we can see a defect here. So the flexible laryngoscopy is a day procedure, like it's a simple procedure done in the OPD, or it can be done in the endoscopy room. So, and it will be done within 5 minutes. And when you do the laryngoscopy, we can see the defect here. So type 1 can be easily diagnosed with this, type 1 or type 2, but we cannot, with this endoscope alone, we cannot grade 3 and 4. We want to know the extent, then we will need CT scan or MRI scan, and along with that we need a bronchoscopy also. So we usually do a swallowing study too to know the aspiration. And this condition is associated with a syndrome or a complex called Vacterial complex, where along with this condition, other like vertebrae or cardiac involvement and renal involvement may be seen. Now coming to the treatment part, if it is grade 1 and grade 2, the feeding technique has to be changed. Mother always has to sit up and feed, as seen in this picture. And the position of the child should be always upright. In spite of this, still the child has got choking sensation or not able to feed well, then they have to change to formula feed, and that to interrupted feeds. If still the child does not improve, then we have to augment that area, this area, with fillers. This is called augmentation procedure, which is done endoscopically. The type 3 and type 4, it can be managed only with surgery. The surgical procedure can be either endoscopic or it has to be open procedure. So this is how we manage case of laryngeal cleft. Thank you so much.